Hello, my name is Wcislo and I am a second-year PhD student in Professor Kevin Reid's lab at the University of Dundee. I'm enrolled in MRC doctoral training program with ICASE studentship, which means that I work in collaboration with non-industrial partner, which in my case is GlaxoSmithKline. My project focuses on Chagas disease, also known as American trypanosomiasis, which is recognized by World Health Organization as one of the most impactful neglected tropical diseases. Chagas disease is caused by an intracellular parasite called Trypanosoma cruzi, and it is mainly endemic in countries of Latin America, where the infection is transmitted through an insect vector. However, due to increased migration in the last few decades, the infection, once confined to the region of the Americas, has now spread to other continents. It is estimated that around 8 million people are currently infected with Chagas disease, with over 70 million more at risk, contributing to at least 14,000 deaths a year. Unfortunately, only 1% of patients have access to diagnosis and treatment, which strongly suggests that the number of unconfirmed cases can be significantly higher. Chagas disease is a lifelong and potentially life-threatening condition and may lead to serious cardiac and gastrointestinal complications. Regarding therapies, the two drugs, benzimidazole and nifortimox, used for over 50 years, are still the only treatments approved for Chagas. They both present limited efficacy once the infection is well established and cause a multitude of undesirable side effects, especially in adults, often preventing those patients from completing the treatment. Many labs try to develop new, better drugs for Chagas disease. Only here in Dundee, several compound series with excellent PK properties were designed, but for unknown reason, all of them consistently failed to give full sterile cure in animal models. That's why in my project, I am trying to better understand the parasite's underlying biology and figure out why new compounds fail to give a cure. One of our hypotheses is that the reason why drugs fail may be hidden in the relationship between parasite localization and drug distribution. I want to know where exactly parasites remain directly after the drug treatment and whether their survival was due to insufficient drug concentration in that area or because of other factors, such as, for example, parasitic dormancy. And while methods such as bioluminescence imaging to monitor parasite load in animal models already exist, their sensitivity isn't good enough to be able to see a single parasite. And from what we know, even one parasite may lead to re-establishment of the infection. And while there are other, more specific methods to study tissue tropism, they often require slicing of the organ into thin sections, therefore disrupting the tissue and possibly losing hidden parasites in the process. I am trying to develop a new technique involving tissue clearing, which will allow me to take a full intact organ from an animal infected with fluorescent parasites, clear it with use of methods such as cubic, and pinpoint the exact location of even a single parasite in a 3D model. Even though tissue clearing methods became very popular in recent years, they haven't been used in parasite localization studies before, so this is a novel method which has a great potential to reveal new, exciting aspects of T. cruzi biology. Next, my drug distribution studies will be performed in collaboration with external partner. The animals will be dosed with various compounds in Dundee and then shipped to GSK in London, where I will have the opportunity to use multi-mass spec machines to study, with excellent sensitivity, how well the compounds are distributed within each organ. In the end, I am hoping to produce an image, or you could call it a map, such as this one, showing exactly the regions where the drug concentration is not sufficient to kill the parasites. Combining it together, I will hopefully be able to tell where the remaining parasites hide after the drug treatment within an organ, and whether the reason for drug failure is caused by the fact that the compounds we used to treat the animals simply didn't get there. This type of technology is not available in Dundee, so having access to it will definitely allow me to explore this area of study in a novel and more advanced way. I consider myself extremely lucky to be enrolled in this program because apart from working on a challenging and fascinating science, I know that when I finish my PhD, I will have great experience working in both academia and industry, which will definitely help me in my future career. I hope you enjoyed my video. This is a very short presentation of my work, so if you have any questions, don't hesitate to ask me during the webinar or send me an email. Thank you.